Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we're going to talk about Lyme disease. I look forward to seeing what you have in store for me tonight and what you create with this webinar, because every week is different because you create it with your questions. So for those of you that are new here, I'm glad to see there's a number of new names here on my message board tonight. The way that you participate is two ways. Number one, you can listen to the questions and the answers that I give for those. Second way, you can write a question. And the way you do that is over on the right-hand side of your screen at the bottom is a chat box. Write your question to me through that chat box. And whenever you click the enter key, it'll send the question to me. So I request, don't try to create multiple paragraphs by hitting the enter key multiple times, because that sends separate questions to me, which gets to be hard to follow. Okay. I see a lot of familiar names here tonight too, and I'm glad to see you're back again. And I'm glad to see you keep getting value here. So this is our last webinar tonight for a couple weeks. I've got next week is my normal week off, and then the week after that, I'm actually going on a 10-day motorcycle adventure by myself, actually. Riding from here to see my my father out in Colorado Springs, and then back again after I visit with him for a few days. So I won't be with you in 2 weeks. So next week I'm off as usual, and then we'll be gone the week after that. Tomorrow morning I will be sending you a link, an email that will have a link for the recording for tonight's webinar, because I am making a recording, and in that recording, or in that email, will also be a link to sign up for the next series of webinars that will be in October. Okay, so just keep your eyes out for that. So I will be back again. It's just that I'm going to be off for a couple weeks here. Let me see here. Oh, during the webinar, I will be posting your questions on the screen so that those of you that are participating in the live version can actually see them. I will be reading them, though, because in the recorded version, they don't show up. Okay, so I will be reading these questions out loud as well, too. All right. And then one other thing, tomorrow when you get the recording, tomorrow when you get the email with the recording, and that has the link to sign up for next week's webinar, share it. Send it to people that you think might get benefit. Help me to reach as many people as possible here. I'm trying to help as many people as possible, and I need your help to do that. Okay. So feel free to send it forward and send that email to others as well, too. All right. So without any further ado, let's go ahead and get started here. Hello, Kuma. Let's see. Number one, for people who can't financially afford the IGenex test, is the CD57 test from LabCorp a good way to see if one has Lyme? Let me answer that one first. So the answer is no, it's not a good test. So a CD57 is a type of white blood cell, a very specific type of white blood cell that is low about 80% of the time that somebody has Lyme, which means it's normal 20% of the time that somebody has Lyme. Okay. Number two, Lyme is not the only thing that causes a CD57 to become low. So if it is low, it doesn't say that Lyme is in you. It could be you've got another cause. And it is possible, for instance, that chronic virus infections might cause it to go low. One virus we know that does trigger low CD57s is the HIV virus, for instance. Okay, but there could be other viruses that cause it to be on the low side too. So it's not a reliable test or an acceptable substitute for various kinds of IGenex testing. Now, when it comes to IGenex testing, if you're really looking to see if it's Lyme that you have, I know IGenex has these panels that get to be very expensive, $1,500, $2,000, right? But really, when you come down to it, you're just trying to see if you have Lyme in you. And if you have Lyme in you, that increases the chances you might have gotten co-infections. The co-infections, you don't necessarily need to do testing to diagnose them. You can look at symptoms to figure out if you have them if you first test positive for Lyme. So when I've got somebody with resource issues, my strategy for testing for Lyme, that's kind of a lower cost way of doing it, is to do IGenex testing for Lyme and to do the Immunoblot test from Lyme. Their Immunoblot is a specific test. It measures to see if your immune system is making antibodies from two families. One is called an IgM, one is an IgG antibody. And we're looking to see with the Immunoblot, are you making antibodies that attach to 8 different kinds of Lyme germs, okay? And that's what makes the IGenex method of testing for Lyme the best, because no other lab out there is looking to see if you have antibodies against 8 different kinds of Lyme germ strains, okay? The other thing IGenex does with their Immunoblot is they remove the possibility of getting a false positive test because they clean up the proteins that they are using from the Lyme germs to remove parts that could hold on to, falsely hold on to antibodies from virus infections. And so using these cleaned up proteins, if you've got antibodies stuck on them, they are only Lyme proteins that are stuck on them, not virus proteins, okay? So that test is the Immunoblot, and it's a $450 test. You don't need to do the whole panels. You don't need to do everything else that IGenex puts in there. If you just do the Immunoblot for Lyme, not the Western blot, but the test called Immunoblot, IgM and IgG, that gets you at $450. You can answer the question pretty easily then if you have Lyme. And if you have a lot of symptoms then of the co-infections like a Babesia or Bartonella, then you would want to treat for those based on the symptoms and not necessarily do the testing for them, okay? All right, so that's kind of how I approach it if I'm trying to do lower cost testing for somebody, okay? All right, number 2, let's see, some doctors say to take doxy with a big glass of water, then eat about 30 minutes later. Others say to eat before taking doxy. What do you think is better, and will food not obstruct absorption? I'm planning to stick to applesauce. All right, so regarding food. So the issue with food is that some food that has calcium in it may decrease absorption of doxycycline. But not all food has calcium in it, okay? Your calcium sources in food are dairy, and that means cow's dairy, and it means cow's dairy or fortified dairy. So milk, cheeses that have calcium added to them, you do not want to take at the same time as your doxycycline. Soy milk and rice milk and almond milk that have calcium added to them, you don't want to take with your doxycycline. You don't want to take calcium supplements with your doxycycline. But actually, all other food is fine, okay? So I have my patients take their doxycycline with food to prevent getting nausea. And the only thing I tell them is don't take it directly with a calcium supplement, or don't take it with any dairy or dairy substitutes that have calcium added, okay? That's the restrictions that I wind up using, okay? And then number 3, let's see, what do you think of goodrx.com/care to find physicians who are willing to treat Lyme? I don't know. I've never looked to see who they're saying treats Lyme. So I'm not aware. I'm not sure. The resource I would look at if you're trying to figure out where to get Lyme treated is ILADS, the International Lyme and Associated Diseases Society, at ilads.org. If you go to their contact us page, through that page, they have a way of requesting from ILADS who are ILADS associated or members that are in your area. Okay, and that would be a way to locate somebody that has some abilities to treat Lyme. Okay, all right. Thank you for your wishes about having a great vacation. I'm looking forward to my annual motorcycle trip. So I'm doing it about a month later. I added Cidacuda about a year ago and liposomal oregano, clove, and cinnamon oil a few months ago. I've done well on this regimen, but I'm wondering if Lyme and Bartonella develop resistance to these herbs when taken for lengths of time. I've been on them, which is 2 years. My observation is that these germs can learn resistance to prescription antibiotics. And for that reason, I usually will try to rotate my prescription antibiotics, not my herbal antibiotics, but my prescription antibiotics, I try to rotate about every 6 months. Herbal antibiotics, I have no problem using them a year, 2 years, or longer, as long as somebody keeps improving. I tend to see that they keep working. That's just been my observation. No one has done studies, though. There isn't a laboratory that's done studies to say how quickly do people get resistance to the herbs. But herbal antibiotics, I find, just seem to keep working and working. Okay, so I would have no problem with you continuing those as long as you keep getting improvement. Okay, stop getting improvement, then you got to wonder if your germs have become resistant. Thanks for that question. Actually, I want to do a quick screen share here. I meant to do this with the first question tonight. Remember in that first question, I said, if you have a positive Lyme test, you don't necessarily need to do Bartonella and Babesia testing because you can use the symptoms. In other words, if you have one tick-borne infection, Lyme, that increases the chances you have another tick-borne infection like a Babesia or a Bartonella, okay? So for instance, what we know on the East Coast of the United States is that if we look at studies out there, 70% of the ticks that carry Lyme carry at least one other co-infection, 70%. And 50 to 60% carry two co-infections, in which usually they're Bartonella and Babesia, okay? So that's why I'm saying if you test positive for Lyme, there's a great chance you might have picked up a co-infection. Look at what the symptoms tell you, okay? So where do you find information about which symptoms to look for? Well, let me do a quick screen share here for you. All right, so this is my Lyme information site, Treat Lyme by Marty Ross MD. Take a look at my online Lyme guide here and take a look over here at how to diagnose, this section called how to diagnose. And in here, I talk about how do you diagnose Bartonella, and which will list out the various symptoms to consider. And then how to diagnose Babesia. Again, I list out the various symptoms. And if you have enough of the symptoms, probably means you might have it. Okay. And same with Bartonella. If you have enough of the symptoms, it probably means you have it. Okay. And those are the situations where I'll wind up treating. All right. Hello, Jim. Let's see. I started Hutania and Sida acuta a week ago, and so far can only tolerate a drop of each. You've said in the past webinars that you've seen some people get better from BART even though they can only tolerate low doses of these herbs. Roughly how long did it take this sort of patient to get over BART on doses quite a bit less than the amount you consider optimal? Also, are there ways to help people like me tolerate higher doses of these two herbs? Thanks. All right. Good question. So there are certain people that I've seen in my practice that are very drug sensitive to anything. Okay, that can mean herbal antibiotics. That could mean detoxification with glutathione. Anything I put them on, they may tend to have a lot of medicine tolerance issues. What I have come to believe about that, and again, there's no science that supports this opinion that I have, but what I've come to believe, what my opinion is that people that tend to be very medicine sensitive, one of the reasons for that is they may be people that cannot detox those medicines out quickly. In other words, they can't remove them, okay? So what ultimately determines whether what happens with a medicine is how much of it are you able to get and keep in the bloodstream, okay? And that's determined by how much do you take and how quickly do you detoxify, do you remove the medication, herbal or prescription. So if you're a person with impaired detoxing, you don't need to take as much to have an effective amount in the blood. And so I have seen a number of my patients where I'm able to use a Sida acuta Hutania, and they're very sensitive and have used only 1 or 2 drops twice a day, and they've recovered from Bartonella. It has often taken about 6 months to a year process, okay, to answer your question, all right? But again, we have to, and those kind of people, you have to kind of move away from the idea of worrying about getting so many milligrams in or so many drops in. What you want to make sure is, are you taking a dose that has an effect? All right. And if it is having an effect, that means there's enough of it in their bloodstream to be doing the work. And that level that's in their bloodstream is determined by how much do you take, only 1 drop twice a day, versus how much can you clean out, which may be blocked, so they're just not removing it as much. Okay. All right. All right. Good luck to you, Jim. Thanks for your question. Hello, Sam. Let's see. Hello, Dr. Ross. What are your thoughts on retesting? I've just finished 18 months of treatment for Lyme, Bartonella, Babesia, and feel better than ever. I treated with Lyme and Bartonella with rifampicin, doxycycline, cefuroxime, and Babesia with artemisinin cryptolepis. My doctor suggested a retest using the Armin Lab's elispot, and to my disbelief, it has come back positive again for Lyme, Bartonella, and Babesia. What would your advice be in this situation? All my symptoms have resolved and I feel great. Okay, so I'm not a proponent of retesting. I'll just start by saying that, okay? And but let me kind of go through a little bit more specifics on that. So when you're doing an Armin Labs T cell test, I want to let you know it has a 15% chance it's wrong. Okay, so I just want you to know a 15% chance it's wrong. So, and that's whether it's a positive or negative test, it can be wrong 15% of the time, okay? So that's number one. I want you to know that, okay? But what this elispot test does is it's looking at your a type of white blood cell in your blood called T cells, and the T cells are what are responsible for killing germs, okay? And those T cells, in theory, will remain active, or the way the test works is we take these T cells and your T cells, and in a test tube, we then add proteins that come from Lyme or from Bartonella or from Babesia, and we see do these T cells make cytokines. And if they make cytokines, it means that sometime in the past, they have seen Lyme, if it's the Lyme elispot, or they have seen Bartonella, if it's the Bartonella elispot, or they have seen Babesia, if it's the Babesia elispot. Okay, now T cells, there's different kinds of T cells. There are what are known as T memory cells, and then there are what we call circulating T cells. Circulating T cells only have a life of about 2 months. So in theory, if your elispot comes back positive, it means that somewhere in the last 2 months, those circulating T cells have seen Lyme. Okay, but here's what the problem is. There's also this other group of cells called T memory cells that can live a long time, maybe forever. I mean, they just keep living. And periodically, they can get into circulation as well, too. So in theory, although, yeah, the majority of T cells are the circulating kind that are not the memory cells. And so therefore, if a test comes back positive, it may mean that your immune system has seen Lyme sometime in the last 2 months, or Babesia or Bartonella. It's very possible that what you're really measuring is T memory cells that are going to stay active even when the germs are gone, okay? So I just don't think that doing that kind of testing to see if the germ is in you is entirely reliable, okay? Second problem with doing that kind of testing is some of my colleagues will look at doing an elispot or repeating antibody test and seeing if they're either not reactive or less reactive, and they take that as a sign that the germ treatment must be done. Well, having an absence of T cell activation being positive, or an absence of antibodies with a Western blot or immunoblot, could be because the germ is gone, or it could be because there's too much immune suppression because the germ is growing like crazy. All right, so having no antibodies or no reactivity in your T cell test doesn't prove the germ is gone either, okay? So there is no testing we have in existence that has been ever validated to show when you are done with treating. And so therefore, in my practice, I wind up using symptoms. And if you truly are symptom-free, and in my practice, I want people symptom-free for at least 2 months, in those situations, I will stop treatment. That's how I go about doing it, okay? All right. So good luck to you on that one, Sam. Thanks for that question. Hello, Michael. Let's see. Hi, Dr. Ross. Thank you for your valuable information on Lyme disease. You're welcome. Let's see. I am a 70-year-old male located in Massachusetts with an unrelenting headache that started over 4 years ago when I was diagnosed with Lyme and later co-infections. The headache is frontal above the eyes with constant pressure. It is not a migraine. I have been tested with CT scans, an MRI, neuroquant MRI with no findings. I have been treated with various antibiotics and fungals, the Buhner protocol, and other herbs. The vertigo has subsided. I'm currently on my 4th week of taking the anti-inflammatory Mariva. I'm also on anti-candida diet and taking probiotics to control yeast overgrowth. As of yet, no real change, mild fluctuations, but the pain is still constant. Do you have any suggestions for resolving this headache problem? Thanks for your help. So Michael, I feel for you. That's a complicated problem to have. And I've got one patient in my practice that had tick-borne illness that the symptom we could not get rid of was the headaches, unfortunately. When I hear of a frontal headache, the main thing I keep thinking of, or that I know I have seen in my practice, is frontal headaches are often associated with babesia. So I would make sure that you treated your babesia long enough, which usually means a minimum of 5 months, with an adequate treatment. And I'll show you my article what I think is an adequate treatment, okay, but an adequate treatment. If you did that, though, and your headaches still remain, it just may not be that this is tick-borne related or tick-borne caused at this point. Other things that can help headaches, besides treating infections, mycotoxin test. My preference these days is to do that from real-time labs if you're here in the States. An acceptable alternative, though, would be the Great Plains test as well, too. See if you're peeing them out. Don't rely just on a lot of people trained to manage mold toxin illness in the Dr. Richie Shoemaker way, only measure inflammatory markers, but those inflammatory markers are only part of the story. You can have mold toxin illness and have normal inflammatory markers. So my preference is get the urine test, see if you're doing that okay. Other things to consider trying, you may have already done this, that can sometimes make a difference for people is acupuncture. I've had good success with a number of my chronic headache patients doing acupuncture too, okay? And then finally, you might want to talk with a neurologist and see if you are a candidate for getting Botox injections. Sometimes that can help with chronic headaches as well too, okay? All right. Good luck to you, Michael. Oh, let's see. It's like, Sam, I think you wrote this question twice. Hold on here. Yep, you did. Hold on here. Let me get rid of that. Hello, David. Let's see. Hi, Dr. Ross. My 9-year-old tested positive via real-time lab for mold. She has trichosethine, gliotoxin, zearalenone. What would be the proper treatment for a child? Her pediatrician isn't very familiar with the mold and simply put her on liposomal glutathione, 5 milliliters once a day per our recommendation. Any advice or thoughts would be invaluable to us as parents. My wife and I also have the same mold toxins and have began treatment. However, we have a difficult time finding treatment plans for kids. You know, I'm trying to, I wish I knew these normal ranges off the top of my head. I believe that trichosethine, though, is pretty elevated, and the gliotoxin, yeah, I would say these are all very elevated. Okay. So the way that I would approach this in my practice, and again, I don't have the benefit of having your child in my practice, and I'm not able to ask 1,000 different questions that I would want to ask. So I'm giving you a caveat. You still ultimately need to discuss this with your physician to see how they feel about this, okay? But for that complex of toxins, I would look at using a broad spectrum binder to include various things that would get at trichosethine, would get at gliotoxin, and would get at the zearalenone, okay? So I would look at probably using the binder called GI Detox, which is made by made by Biobotanical Research. You had a real-time test, but made by Biobotanical Research. And what that has in it, it's got charcoal, it's got clay, it has humic acid and fulvic acid in it, and it's got some silica. Those are substances that will bind up toxins, but a variety of toxins, okay? All right, now, normally in a full-size adult, I would want to, full-size, I'll say 150 to 200-pound adult. I would try to work up to dosing at 2 pills twice a day. That's what I would try to get to, okay? Your 9-year-old relatively is about half that size, and I'm just I don't know the exact weight of your child, but I'm just saying what a 9-year-old typically would weigh. So I might start out by trying 1 pill 1 time a day of the GI detox. And in a week or 2, if that has not caused your child to flare up, then you might consider going to 2 pills 1 time a day, okay? But I have to say, I think, I can't be your physician. I'm just giving you a general guideline here. This is something you ultimately should share with your physician and see if they agree with that, okay? All right. All right. Good luck to you. Good luck to your 9-year-old too. All right. Hello, Bob. Let's see, Dr. Ross. I had labs drawn via LabCorp last week. My CD57 in July was 383, and now it's a whopping 490. The normal range is 60 to 360. What can be causing this highly elevated level? Is this concerning or dangerous? I have been diagnosed with Lyme, Babesia, and Bartonella. I've been taking vitamin C, D, curcumin, liposomal glutathione. Thoughts. Okay, so first of all, I want to let you know that even though the 383 and the 490 look a lot different, they're relatively the same. How can I say that? Well, let me talk to you about that. So there's been studies done about CD57 and accuracy of the testing, and that any level that you get of a CD57, the reported value actually could be, in reality, maybe 30% lower or 30% higher. Okay, so that 383 is a range that could extend 30% lower in reality, or a level that is actually 30% higher. All right. So if you look at that and then look at that 490, they may overlap when you do a plus or minus 30% on each of those numbers. Okay, they may relatively be the same number. Okay. And that's the problem with doing serial CD57 testing, is that when you get a test, you do now, and then you do another one 3 months later, and it's higher or lower, you have to apply the 30% rule, and you may find that they're all relatively the same number when you compare a 30% below and a 30% above, as this number is, okay? So my answer to you is this may not even be a real increase, okay? All right. Number 2, we don't know what causes elevated CD57s. I don't know what does. And when we use CD57s, it can be a clue that Lyme is there if it sits at about 100 or lower. But I haven't seen any discussions about what high CD57 means, okay? But I would caution you before getting concerned that if you take 490 and you divide, those numbers fall in, there's an overlap when you do the plus or minus 30% on those that put those as actually being the same number. Okay? All right. Good luck to you, Bob. Hello, Gail. Let's see. Keep your brain engaged in healthy neurology while you're doing something. Keep brain patterns focused on something positive or constructive and taking you in a straight line and not going in a loop. Number 1. Thing to do to expand training zone is to catch pops. Pops are emotions, thoughts are habitually residing. Hello, Maxine. Hello. I received a result of 2, weak positive for Borrelia, a full antigen from Armin Labs. Rest of the Borrelia results are 1 or 0. Same with co-infections. Does this mean I have Lyme? Need to investigate further with further testing. Okay, so the relevance or meaning of a test increases with the chance you got the illness and increases with the number of symptoms suggesting the illness, okay? So if you are a person that has no symptoms and was never bit by a tick, this probably doesn't mean anything, okay? If you are a person that has tons of symptoms that look like Lyme disease and you were bit by a tick, then this could be interpreted as a weakly positive test. So in other words, I would need to know a lot more about you to figure that out, okay? All right. keep in mind, as I mentioned earlier today, this Armin test is an immune system test. It's looking to see if your immune system T cells are reacting against proteins from Borrelia. And if there is so much Lyme in your body going on, it could suppress the immune system, causing a weak reaction. Okay. So if you are a person seeing me and you had this type of result, but you had a lot of symptoms suggesting Lyme, and you also had a history of a tick bite, I would probably call this a positive test. All right. Thanks for our question, Maxine. Hello, John. Can liposomal glutathione alone get rid of mold toxins and time outside the mold environment, or do you always require a binder? So liposomal glutathione is unlikely to get rid of mold toxins. The reason is glutathione. So what happens, I have to explain what goes on in mold toxicity illness to make that point. So in mold toxicity illness, there's 25% of people that have mold toxicity issues. What happens in 75% of people, these are the normal people. Whenever we breathe in a mold toxin from the world around us, our white blood cells, some of our white blood cells will tag those mold toxins. And once they get tagged, other white blood cells will come in and break those mold toxins down. Okay. So that's what's supposed to happen. All right. Now, in people with mold toxin illness, they have a genetic programming mistake where their white blood cells that are supposed to do the tagging don't tag those mold toxins. So therefore, other white blood cells do not come in and break down the mold toxins. Okay. All right. So they don't get broken down. The next step that then happens is these mold toxins, which are fat soluble, go to the liver, and the liver is supposed to transform them from being a fat soluble toxin into a water soluble toxin. And if the liver was able to do that, it would then move these water soluble toxins through the gallbladder out into the intestines, where being water soluble, they would mix in with our poop and we'd poop them out. Okay, but guess what? The liver doesn't do that either. All right. What the liver would use to be able to do that is glutathione. But the liver, even with lots of glutathione, is not able to change mold fat toxins into water-based toxins. So therefore, taking a bunch of glutathione isn't going to do anything to get that process to happen, okay? So these toxins will leave the liver, even if you have a bunch of glutathione, as a fat-soluble toxin, and they go out into the intestines as a fat-soluble toxin, and they get reabsorbed right back into your intestine or into your bloodstream. So you just get this endless loop going around, all right? So you do need to grab hold of them. And that's what grabs hold of them out of the intestines is a binder, okay? All right. Good luck to you, John. Hello, Elizabeth. Let's see. Do you think I can treat chronic Lyme and Bartonella with just herbs? Do they cross the blood-brain barrier and help with neurologic symptoms? I'm not ready to try antibiotics because my tests are inconclusive. All right. So I can reflect what I see in my practice. I can tell you no one has studied this to tell for sure. Okay, there aren't comparison studies. Okay. My experience though is herbal antibiotic regimens that I use a lot of cat's claw combined with otoba bark. I find those work well, even with neurologic Lyme, about 80 to 85% of the time. That is the same chance that I see of getting help from doing any prescription antibiotic combination. Now, keep in mind, if you do one prescription antibiotic combination that's not helping, that doesn't mean the next one won't work. So any combination at the beginning has a chance of 80 to 85%. I'm sorry, 85 to 90%, excuse me. And I give the herbal combination of the Banderol, which is Otoba, and Cat's Claw together, an 85 to 90% chance of working too. Okay, so from a Lyme standpoint, the Lyme germ standpoint, I think you have an equal chance of herbal antibiotics working compared to prescription antibiotics, all right? In terms of Bartonella, in my experience, I see that Bartonella has helped effectively herbally using Psittacuta houttenia, and now I'm adding in liposomal cinnamon, clove, oregano oil to that. Sometimes cryptolepis I add to that these days based on newer studies. But those kind of things will work for Bartonella about 70 to 75% of the time, versus prescription antibiotic combinations will work 80 to 85% of the time, okay? So for the Lyme germ, you're probably not giving up efficacy by trying herbs over, initially trying herbs over prescriptions, all right? For Bartonella, you decrease your chances of getting better by about 10%, but there's still pretty good odds, okay? So that's the kind of information I share with my patients and let them decide what they want to do, okay? All right. Good luck to you, Elizabeth. Gail, thanks for that message. Gail says, disregard this. So, I was wondering if it was a mistake. She says it's mistaken. So anyhow, thanks, Gail. Hello, Elizabeth. Let's see. Do you think I can treat chronic Lyme and Bartonella with... Oh, we just answered that. Hello, Gail. Hold on here just a minute. I think this is the real question. Hi, Dr. Ross. I started rifampin 3 days ago. My LND said that I cannot titrate up slowly as there is a very high risk of bacterial resistance in doing so. Then I should do 300 milligrams for 3 days and then start 600 milligrams for a few days. I can spread the two 300 milligram doses apart and then combine them to take the full dose at once. 1. How fast do you have your patients titrate up, and or how slowly do you allow them to titrate up? 2. Have huge increases in old and new symptoms. He said, all right, let me look at the first part of that question. So first of all, I don't agree with that. Now, I mean, I don't, that's not my opinion, okay? I would say that there's no studies that document that, either my opinion or his opinion or her opinion. But I have no problem with people starting low. When I've got somebody, for instance, that has issues with having strong Herx reactions or a lot of medicine sensitivities, my advice to them is to start at 300 milligrams. Sometimes I'll even start at 150 milligrams, and one time a day, and be at that for about 7 days. And as long as they have not had any kind of a severe reaction, then at 7 days they can increase up to the next dose. In your case, that would be up to 600 milligrams, for instance, okay? And I don't find any change in efficacy by doing that versus going to full dose right away, okay? All right, number 2, having huge increase in old and new symptoms. He said to stop by accident for now and keep going with rifampin. Do you agree with this, or necessarily have people decrease or stop? But I don't know how to answer this without getting more into asking you a lot of questions about specifically what's happening with you. That's for your second question. Your third question, how long does one give these two drugs before deciding if they are working or not? I've gotten so much worse since adding in the 3 milligrams of rifampin. I can't fathom going up 600 milligram. Biofilm interface plus making me thick. All right, so Gail, here's the issue. I would need to know a lot more of what's happened on the rifampin, because if you've gotten sick, it could be Herxheimer reaction, or it could be you're having side effect issues. And I would need to kind of query you a lot more. So I can't answer this question without being able to do that, okay? Sorry about that, okay? All right, good luck to you, Gail. So a number of people here are are writing their questions 3 and 4 times. It's not going to get you answered anymore, but I'm getting rid of comments here that have already been posted that we already answered. So bear with me here a minute. Let's see. All right, here we go. This looks like a new question. Hello, Heather. Hi, Dr. Ross. Thanks for doing these. You're welcome. I was just diagnosed with Bartonella after treating Lyme for 4 years and not improving. A couple years ago, I was treated for BART based on symptoms alone. It was given 400 milligrams doxycycline per day with 250 milligrams of azithromycin. I was on this for many months. It seems like I should have been on 500 milligrams of azithromycin. Do you think that my Bartonella will now be resistant to azithromycin? Also, I was reading about rifampin causing red staining of urine, teeth, and tears. Have you seen this happen? Okay. So regarding rifampin, one of the common side effects is it does turn your urine orange, and it does turn your tears orange as well too. And so, yeah, you will see that. That's a common symptom. I'm not entirely clear what happens, but it's a common side effect. It's not a harmful side effect. The only problem would be if you're wearing contact lenses, it can be hard to see through that redness, basically, okay? And then in terms of, let's see, how long, bear with me here. I'm going to answer that first part of your question. I have to read back through it, though. All right. So in my practice, yes, I mean, you raise a valid concern that you are on the azithromycin for many months in the past, okay? But your message says that it has now been about 2 years. I go back and try medicines again that somebody stopped using a year or more, even if they were on it for a while, and I often find good effects from it still, okay? And I think that sometimes the germs can learn resistance, but then they unlearn it. So I will use antibiotics even if somebody's been on them multiple times, as long as there's some period of time that they've been off of them. And I think a year or 2 years is probably long enough here. So you might give it a try and see what happens. And yeah, my preference when I'm using azithromycin to treat Bartonella is to go more the higher side on that dose, so the 500 milligrams once a day would be more of my preference for dosing on that as well too. Okay. All right. Good luck to you, Heather. Thanks for that question. Hello, Cam. Let's see. I'm having a hard time affording all the supplements and detox stuff that goes along with Lyme and co-infections. I've been taking liposomal glutathione by research nutritionals, but it's just too expensive to keep taking twice a day. Could I take it once a day and then take the other dose as glutathione reduced from yarrow? Or would it be better to cut corners elsewhere? Also, could you recommend a good oil of oregano and explain the importance of getting the right kind of oregano? All right. Cam, I don't know enough about your treatment and your symptoms and everything else to be able to answer this. You really probably should sit down with your Lyme specialist and say, hey, I can't afford all this stuff. What is it that we can do that's more essential? And I'll do that with my patients every now and then too. So that's would be my suggestion, okay? Because I don't know that the research nutritionals product for glutathione is going to be a much better product than the yarrow. So I don't know that your idea is necessarily going to work. I'm not clear why your practitioner has you taking the glutathione twice a day. Often once a day is enough, but they may have a reason for that. And I don't know enough else of what you're on to figure out what you could get rid of, not get rid of. And I don't know enough about your symptoms and everything else, okay? So I think you need to talk to your practitioner about that. In terms of oregano, I like using liposomal oregano, and I like using it because the liposomal means it's wrapped in fat, which increases its absorption, okay? That is if you're using oregano to treat Lyme and Bartonella. You want to get it in the bloodstream. If you're using oregano, though, to treat yeast overgrowth in the intestines, then you could use a regular oil, and it will probably get down into the intestines, okay? The product I like for liposomal oregano oil is made by a company called Dr. Inspired Formulations. Their product is called Liposomal Oregano Essentials. It's a 75 milligram pill, and I usually have people take it as one pill twice a day, okay? All right. Good luck to you, Kim. Patsy, thanks for your comment. I appreciate that. Joyce, thank you for your wishes for my safe travels and time with my dad. I appreciate that too. Thank you. Hello, Lewis. Let's see. Rather than taking a systemic oral antifungal, are there any nasal passage techniques, such as things that I could breathe in using a humidifier? I feel like my forehead and cheeks have been colonized. A CAT scan technician even asked me if I had allergies because of all my passageways were very swollen. Is it possible I might also have low-level food allergies? I eat lots of broccoli, so maybe it's sulfur. Thank you. So in terms of allergies and the nasal passages, I mean, there's many things that can trigger that. There can be environmental allergies. They could be food allergies in your gut, triggering your immune cells that line the intestines to make and manufacture histamines that go up to your nose and cause some of the changes that you're describing here. All right. So unfortunately, you all are throwing out a lot of questions to me tonight that I can't answer. In terms of your best approach and trying to figure out about food allergies or figuring out anything else, I would probably need to ask you a lot of questions. If you are trying to see, though, if food allergies may be related to your sinuses, you could try to do something called an elimination diet, where it's a type of diet where you remove things that a lot of people can be allergic to, and you see if your sinuses get better. You want to remove the food items for at least 3 weeks, and then you can slowly try to re-add them again one at a time and see, do you react? Do you get more stuffy? Do you get more fatigue? If you do, that means you're sensitive and possibly allergic to that food item, okay? All right. I'll show you in a minute where you can go to look at that type of a diet, and it has information about how you implement that type of a diet too. It tells you what to take out and how do you add them back in, okay? In terms of ways to get things into the sinuses, so the sinuses are hard to get at. So often taking something through the bloodstream, like a systemic antifungal, is going to be the best way to get into the sinuses. Sometimes what we breathe in can work there, but not as well as taking a pill form, okay? Will a humidifier help? It might, but if I'm going to use something directly in the nose, I'm actually going to do antifungal nose sprays made up of either, I might do a nystatin nose spray, I might do a fluconazole nose spray, I might do. All right, let's see here. So take a look at my online Lyme guide and then look in the section called Nutrition and look at this article called Elimination Diet to Find Food Problems, okay? It walks you through how do you approach this, basically, all right? Good luck to you, Lewis. Hello, Thomas. Hold on here just a minute. Let's see, I had a 5.1 okra toxin on Great Plains Lab, but I don't know if that is likely to be symptom causing or if that's just a normal reading since we all breathe in mold in our normal surroundings. Also, do you prefer, did you prefer Real-Time Labs or Great Plains for mycotoxin, and how long did it take for the results? And do you know what the price is? Thanks. Okay. So as I've worked with both Great Plains Lab as well as Real-Time Labs, I'm finding that Real-Time's, I think, has a bit more accuracy and maybe stronger at picking up black mold toxin. I find that perhaps Great Plains is good for okra, maybe glutathione, but I'm preferring Real-Time more for the other toxins. Okay, so I'll just start by saying that. A Real-Time test can be $399 for the initial test, but they reduce their price. I believe it's $250 for the repeat test. And so if you do have the problem, you have to do a lot of repeat testing. In the end, doing the Real-Time testing may be cheaper than doing the Great Plains testing. Great Plains has a cheaper upfront price. I think it's $299 for the initial test, but their repeat testing is also $299, a repeat test, versus the Real-Time is cheaper at $250. I believe it's $250 on the repeat test. Okay, all right. And then, the Great Plains Lab, I'm not, so off the top of my head, I always have to look at what their numbers are, and I don't remember what is normal number for okra toxin off the top of my head. I think their normal is maybe around 3. I can't answer your first part of the question. I would need to pull up one of their lab forms in front of me to say how abnormal or how close to normal that is, and I just don't have one here that I can take a look at quickly. Okay, sorry about that. I still rely on labs telling me what their normal ranges are, and this one I just haven't memorized off the top of my head yet. All right, thanks, Thomas. Hello, Brandy. Let's see. Have you ever recommended citrus pectin, apple pectin, or okra powder, spirulina, chlorella, barley, or wheatgrass zeolite as bounders, or are they knives to a gunfight? I know your website mostly specifies charcoal, bentonite, clay, and cholestyramine. Thank you. All right. So I do believe on my website I do talk about citrus pectin. I do use that as a broad spectrum binder. And I think it has as good of a chance as helping as any of these. So cholestyramine, bentonite clay, charcoal, pectin are all things that I think have equal chances of helping you, but we choose them based on what your mold toxin pattern is, okay? And so, for instance, we choose them. Different toxins respond better to different binders, all right? But I consider pectin to be broad spectrum, meaning it usually can pick up a lot of different binders. Toxins. Cholestyramine, I consider to be broad spectrum too, okay? In terms of, let's see, okra powder, spirulina, chlorella, I consider to be weak. The okra powder and spirulina I have not used. Barley, wheatgrass, I have not used. Zeolite would be zeolite clay, which I put in the same class as bentonite clay, which could be fairly powerful, but it's not going to be broad spectrum by itself, okay? All right. Hope that answered your question. All right. Good luck to you, Brandon. Ooh, sorry about that, everyone. Let's see. Hi, Justin. Let's see. Hello. Do you know if disulfiram can be used with below medications? And the medications are Bactrim, Ceftonir, Cipro, clonazepam, fluconazole, hydrocortisone, ivermectin, lamictal, metronidazole, pyrimethine, leucovorin, rifabutin, sertraline, Wellbutrin. So off the top of my head, but I don't have a drug reference in front of me, off the top of my head, I don't see an issue with using disulfiram with any of these at the same time, okay? However, if you were to be on all of these at the same time with disulfiram, I would want to be checking drug interactions, okay? Using a directory, a computer directory that tells me Are there things to be concerned about? But off the top of my head, I don't think there's an issue here. Okay? All right. Thanks for that question, Justin. Hello, Marina. Let's see. Quick question. I've been getting Myers cocktail IVs, and they seem to be real helping me. Is this something you've seen in your practice, or am I making this up? No, I've seen it help. In fact, I used to do them in my practice. I just don't have the staff to do it anymore. But so Myers cocktails, everyone, is a multivitamin mixture that has B complexes in it, B12, vitamin C, magnesium, and some other micronutrients that are added to it as well too. The idea that when you give it in high concentration. And because you give it in such high concentration, it can work its way into cells that may not be functioning correctly. So when you have illness, sometimes the cells that need nutrients lose the ability for their normal transport mechanisms to carry nutrients to the inside. Okay, so they use proteins, they use different channels that are supposed to open and close and allow nutrients like magnesium to get to the inside where they're needed. If a cell is really sick and it's not working correctly, its normal transport channels and its transport proteins may not work effectively enough to absorb nutrients to the inside. All right. So if we put something, the way that there's a dynamic that happens in physiology, where if you put something on one side of a cell membrane that has high concentration, and compared to the other side of the cell membrane, it will diffuse through that cell membrane into the other side, okay, without using transport mechanisms. So the idea behind IV nutritionals like this is we give you high doses of the nutrients, and even though your cells may be impaired in their ability, their mechanisms to absorb, these nutrients will still force their way across, diffuse their way across the membrane because they're in such high concentration on the blood side that they will work their way to the inside of the cells where there may be deficiencies. And that really can help some people with their energy. So no, I doubt if it's false. It probably is helping you for a specific reason. Okay? All right. Good luck to you, Marina. Hello, Maxine. Let's see. Are internal tremors a symptom sign of Lyme? So I often assume or see that internal tremors are an issue with people that have Bartonella. And I see that as I get Bartonella under control, often the internal tremors and buzzing sensations go away. Okay. That earlier. Hello, Rich. Let's see. What do you think about taking a Lyme-specific transfer factor supplement? I have a product made by Research Nutritionals called L+. All right. So let's talk about what transfer factors are. So transfer factors are substances that are made by white blood cells when certain white blood cells, I'll call them the detective white blood cells. When detective white blood cells detect an infection, they will make these substances called transfer factors. The transfer factors then and they're specific to a germ. Okay, so if your detectives see Lyme germs, they will manufacture Lyme germ transfer factors. Those transfer factors go out and will attach to the Lyme germs, making them more easily seen by other white blood cells that will come in and gobble them up. And those transfer factors also turn on white blood cells to gobble up those Lyme germs, okay? So every germ that we get has specific transfer factors for it. So cold flu viruses, actually HIV virus, if you were to get it, has specific transfer factors for it. Human herpes virus type 6, which is a respiratory herpes virus, has specific transfer factors for it. Bartonella has specific transfer factors for it, okay? The Research Nutritionals product called L Plus has in it transfer factors against Borrelia, which is Lyme, Babesia, Bartonella, Chlamydia pneumoniae, HHV6, CMV6, and CMV, and the Epstein-Barr virus. Okay, I believe that those are all. Actually, we'll go look here in a minute. I have we can look at that together. Okay, so anyhow, if you were to take this product, it may target your immune system to more effectively attack Lyme germs. Okay, if you have significant immune suppression, this may be one way to turn your immune system on to help. So, can some people get help with this? Yeah. I will use it sometimes and see even Herxheimer reactions develop on it. And I will see benefit that happens from people from using it too. Okay. All right. So let me just do a quick screen share here. Okay. So Research Nutritionals has a variety of products that are transfer factor products. So I just searching my, this is my Lyme disease, or I'm sorry, this is my supplement store where anyone can buy the products. But these are products that I use with my patients in my practice. And in my articles where I'm describing what to use to treat various problems in Lyme, this is a place you can find the products that I recommend. So anyone can buy here, or if you're wondering what products do I recommend for curcumin, you could write curcumin in here and you would see. The reason I carry my own supplements and have my own supplement store is that I want to make sure that my patients get quality products. And in the world of supplements that is out there, it's a jungle. There's been good studies showing poor quality products at supplement stores. And so I try to do a good job of selecting, curating high quality products, basically. Okay. All right. So, and feel free to use my store. Anyone can use it here. We ship to you out of Austin, Texas, which is where my shipping center is. And as long as you buy over $50 in supplements, there's no shipping fees. And in addition, I cover the taxes, so there's no taxes if you get from here too. Okay. So anyhow, that's my spiel on my store. But these are the transfer factor products from Research Nutritionals. And in each one of these descriptions, I put what is it supposed to target. So for instance, transfer factor L+, if you look at my product description, I tell you, in every one of my products now, I have a section that is called Key Functions and Actions, okay? And in this one, it's known to target, or it's just the ingredients are set to target Borrelia, Bartonella, Babesia, Ehrlichia, Epstein-Barr virus, HHV6, cytomegalovirus, and Chlamydia pneumoniae. Okay, so that's what that one targets. Let's see, there's another product, for instance, called transfer factor plasmic. This is one I tend to think of as being one that targets various chronic virus infections. And so these transfer factors in this product target Borrelia, actually, Epstein-Barr, HHV6, cytomegalovirus. Anyhow, I walk you through all the things that it targets here, okay? So if you're wondering which transfer factor product you should take that might boost your immune system for your various infections, take a look at my transfer factors by just writing transfer factor up here, okay? And then see what pops up. And in each one of these products, I describe what it's supposed to target, okay? All right. Good luck to you, Rich. Thank you for that question. Hello, Dave. Let's see. What do you think of the IGenex test for Lyme and co-infections? It seems like a very high percent of people that get the test turn out to be positive. Do you think the tests are too sensitive since so many people test positive through IGenex? The answer is no, I don't think it's too sensitive. So keep in mind, so IGenex has specifically designed tests that it then validates, okay? So there's a lot of labs out there, for instance, God, what is the name? There's a newer lab that has come out that they are, I'm blanking. It'll probably come to me here in a minute. You want to make sure that if you're doing testing that you work with a lab that has validated its test. And what validation means is that they take a sample that has a known illness or known germs in it, and then they see how good is their test. A sample that has known and a sample that is known not to have the infection. And then they look and see how good is their test at finding it and how often does their test overfind it. Okay. All right. That's validation studies. Okay. IGenex has gone through each of their tests and done validation studies showing that most of them are 95% or so sensitive. I'm sorry, that would be more their immunoblots. They're 95% sensitive, and they have a specificity, their ability to be correct when they find a result of about 95 to 100% too. Okay, so they're actually pretty good tests. Okay, so actually I do trust them. All right. I wish I could think. There's another newer lab system out there that has been doing co-infection testing, and I'm just blanking. I just had a patient that came in with it the other day, and I don't trust the lab because they've never validated their stuff. I'm sure it'll come to me. I'm nearing 60, everyone, or actually I'm 59. But as I get closer to 60, there's periods I just don't remember things right off the top of my head as well as I used to. So it'll come to me here in a minute. There is one lab, for instance, out there. I'll give you their name, called DNA Connections. DNA Connections has come up with a testing that looks in your urine using a technique called PCR testing to see if you have various infections. The trouble I have with that lab system is they never validated any of their studies. I don't know if their studies are accurate. They've never shown me a validation study because they've never done their validation studies that tell me what is the false positive rate, what is the sensitivity, what is the specificity, okay? Versus IGenex has gone through the steps to do that, okay? All right, so I trust them. I think they're accurate. Keep in mind too, Dave, that when you're looking at the testing, a test is only as good as the amount of symptoms and risk that you have of having the problem. All right. So if you get a positive test back and you have no symptoms of an illness, you may not have the illness. All right. So keep that in mind too. Whenever we use these tests, we're not just looking at the test, at least I don't. I'm looking at the patient and trying to see, okay, does this make sense? Is this a correct clue in a sense? Okay. All right. Thank you for that question. Ellis, I see that you started to write a question, but I don't have a full question here, so I can't answer it for you. Hello, Dave. Let's see. Do you have any advice to help out with very cold feet and also very poor circulation to the surface of the skin, especially in the legs? Dave, I'm going to give you some generic ideas. Again, it would all depend on specifically what your health problems are that are causing it, okay? But one observation, sometimes when people have chronic infections like Lyme and Bartonella and Babesia and all those, one of the things that can happen in those conditions is you can get a phenomenon called Raynaud's phenomenon. Raynaud's is an autoimmune type situation where those infections trigger spasm of the blood vessels near the skin, and you get coldness and blue. Now, that spasm can occur from any kind of a temperature variation. So it can occur if you go into heat, or it can occur if you go into freezing, okay? If it's that kind of a situation, from a prescription standpoint, I like using calcium channel blockers, something called Norvasc or something called Procardia, sometimes can be quite helpful for something like that, okay? Herbally, if that's the kind of situation you have, I like working with ginkgo biloba. Ginkgo biloba, many of you may know, is the medicine that's recommended for people with Alzheimer's because it can help with thinking. But what it does is it makes it so you get better blood flow, that blood can flow more easily into very narrow places. and that would be at 80 milligrams twice a day, sometimes can give help, okay? Now, another reason you can have circulation issues and blood flow issues that is Lyme and tick-borne illness related is when you have chronic infections, the immune system in responding to those chronic infections sometimes will over-manufacture blood clotting proteins. And these blood clotting proteins can thicken up your blood, make it so it doesn't flow as easily, and therefore you're just not getting enough blood flow to the tissues and even your skin, okay? If that's the situation that's happening with you, then using something that would decrease the amount of these clotting proteins in your blood, and what can be quite useful at that is to use, or may help with that, is to use a group of enzymes that come from earthworms called lumbar kinase. Lumbar kinase breaks down blood clotting proteins, okay? And the dose on that would be 20 milligrams twice a day. But those would be two thoughts, and I would suggest you probably explore this with your health provider who knows a lot more what's going on with your underlying illness. They can help you figure that out, okay? All right. Good luck to you, Dave. Hello, Kathleen. Let's see. Hi, Dr. Ross. Can medicines like rifampin be taken in partial quantity, I think you mean? For instance, opening the capsule to take less if it's hard to take at full dose due to side effects. The answer is yes, you could give it a try. Sometimes I'll have people take 1/2 capsule of that and you can put it in your tongue and swallow. You can put in a little water and try to drink it down that way, but that would be fine to do. All right. Thanks for your question. Hello, JJ. Let's see. Dr. Ross, are you familiar with extracorporeal blood ozonation and apheresis, where they do apheresis and ozone at the same time? Is this something you have recommended? So I have not seen both of those done at the same time, so I can't comment specifically about that. I can comment about ozone, and that I disagree with my colleagues who seem to think it's a good germ killer, no matter how you use it, okay? And so let me talk about ozone real quickly. So ozone, if you take a test tube full of germs and you put ozone in the test tube, the germs will die. That's great. Oh my God, and that means that ozone can kill anything, right? So we think, oh, let's use it for Lyme. We'll kill the Lyme with ozone, all right? But there's a huge problem with that. Ozone's an oxidizing agent, okay? And our blood is full of antioxidants, okay? So they've done experiments where they take that test tube, fill it up with germs, and put a drop of blood in, then put ozone in. Guess what happens? No killing at all, okay? So I really think a lot of people are wasting money and wasting resources doing their IV ozone, IV hydrogen peroxide, extracorporeal ozone, extracorporeal hydrogen peroxide, any of these oxidizing agents that people are using because they think they're germ killers. I just don't see it. Now, it is possible that when you do ozone, there's good studies that show that there is one reason people may feel benefit from it, and that is ozone results in better oxygen delivery into your cell energy factories called mitochondria. Inside mitochondria is where cell fuel is produced, okay? And if you ozonate or oxygenate your mitochondria, you get better functioning of the mitochondria, and so people may feel better as a result of doing their ozonation, okay? All right. So I've written a whole article about ozone and oxidizing agent medicines and why I just don't think they're good germ killers. I reference it if you want to take a look at that. I'll show it to you here in a minute. But I know a number of my colleagues are doing this stuff, and I just disagree with it, okay? All right. Let me do a quick screen share here. All right. So take a look at, I'll just do a search at my, again, this is my Lyme information site. So my article on ozone is called Ozone, Hydrogen Peroxide, Vitamin C, UV blood irradiation, and Lyme. Okay. And I walk you through why I don't think it's an active germ killer. I show you the science that says it's not a good germ killer. And then I tell you about what I think it does do. Okay. All right. Let me go back here. All right. JJ, thanks for that question. Good luck to you. Hello, Maxine. Let's see. Hello, Dr. Ross. Do you ever use cholestyramine as a binder for toxins? Yeah, I do. I prefer working herbally, though, because we tend to get less side effect issues. So the big problem with cholestyramine is it constipates a lot of people. And because of that, it's kind of hard to use in this illness. But if you're a person that doesn't get constipated on it, yeah, I have no problem using that as a good broad spectrum mold binder, mold toxin binder, that is. Okay. All right. Thanks for the question. Hello, Kristen. Let's see. Hi, Dr. Ross. My son is 30, and at the age of 2, he was diagnosed with IgG, IgA, IgE deficiencies. He had severe eczema as a child. His daughter, age 4, my granddaughter, has severe eczema. I was diagnosed with Lyme, Barton, Babesia mold, etc. What do you know about the relationship between eczema, Lyme, etc.? Interesting. So I have not seen any relationship between, well, in general, hear me out on this. In general, I have not seen Lyme and co-infections cause eczema, okay? Unless Lyme and co-infections have also triggered something called mast cell activation syndrome. Okay, so your mast cells are your allergy cell in the body. They're where histamines are made. And if something allergic lands on a mast cell, it will trigger those cells to make and manufacture histamines. Eczema is an allergic type skin condition. Okay, that's one of the reasons for it. Okay, now in Lyme, we now know that Lyme, mold toxin illness, chronic infections, stress, all work to turn on your mast cells and turn them into histamine producing machines. And that can lead to flaring up of eczema, actually. So to answer your question, indirectly, I think that Lyme and co-infections could trigger mast cell hyperactivity, contributing to eczema. Okay, that's possible. Okay, that's one possibility. The other possibility is that when you have Lyme and co-infections, especially if you've used antimicrobials, you may be set up to get too many yeast in your intestines. And if you have too many yeast, they do a couple things. Number one, they trigger mast cells, all right? But also, they release toxins. And those toxins get into your bloodstream, go to the skin, and at the level of the skin, they will cause any underlying skin condition to worsen. Okay, and that could be eczema. Sometimes people get a lot of pimples and acne. So that's another indirect way that in these illnesses, you might see problem with eczema developing or worsening as a result of a secondary yeast overgrowth infection in the intestines. Okay. All right. Kristen, thanks for that question. And good luck to you. Hello, Rich. Let's see. What do you think of the theory that the majority of Lyme, Barton, and Babesia symptoms are actually not caused by those infections, but instead the symptoms are caused by reactivation of dormant herpes 1 to 6 viruses? I don't agree with that. So my experience has been, well, let me step back for a minute. So when we look at these viruses, the herpes step type 1 through 6, these are chronic viruses that exist in healthy people, all right? So we pull a bunch of healthy people off the street that call themselves healthy. We might find laboratory evidence of HHV6, HHVs that you have here, cytomegalovirus, Epstein-Barr virus, parvovirus, B19. whole host of elevated antibodies against these infections, and these are healthy people, okay? All right, now it is possible when you get chronic Lyme, Bartonella babesia, that those infections lead to immune suppression that allow for the viruses to get active. If those viruses do get active, they're going to trigger more inflammation chemicals called cytokines to be made, just like Lyme triggers cytokines and Bartonella triggers cytokines and babesia triggers cytokines. And it's actually, when we say somebody has Lyme, Bartonella, babesia symptoms, the majority of those are excess cytokines, okay? In my practice, what I have found is that the approach is not to go after the viruses. The approach is to go after the bacteria infections and the parasite, the babesia that is. Go after your Lyme, Borrelia, Bartonella, babesia. Get those under control, and the immune system will kick in and take care of those viruses, okay? But I have not seen any evidence to suggest the way that you're describing here, okay? All right. Thanks for that question, Rich. So keep in mind, everyone, when we say somebody has Lyme symptoms or chronic viral symptoms, that they're really, most of those symptoms are due to too many cytokines. So white blood cells, when they see viruses or they see Lyme, they see babesia, they see too many yeast in your intestines, they see too many mold toxins in your blood, they manufacture cytokines. Cytokines are good and bad. On the good side, they're turning the immune system on. On the bad side, if the immune system doesn't do a good job, it's going to keep trying harder and harder, and it's going to make too many cytokines, okay? And too many cytokines give you brain fog, make you hurt all over, make it so you can't think, can interfere with your hormone production, give you fatigue, suppress the immune system, et cetera, okay? So all of these things trigger too many cytokines. In my practice, doing this for years, I have found the most benefit in situations where somebody has viruses and Lyme and co-infection, going after the Lyme and co-infections. I have not found good benefit going after the viruses, which leads me to believe that the majority of the problem is actually Lyme, Bartonella, and babesia, okay? All right, thanks for that question. Hello, Charles. Zeal Dr. Ross. My new NP doc ran a tick-borne test through Vibrant Wellness, and it shows high IgM for Borrelia according to their criteria and moderate IgM for Coxsackie virus. She wants to let the Borrelia treatment wait until we address the virus and also slightly elevated cyclospora. Mold is my main issue, but I'm wondering how long should I ignore the Lyme? Okay, so first of all, remember earlier tonight I was talking about a lab that hasn't validated its testing techniques? It's Vibrant. That was the lab I was trying to remember. Vibrant Wellness, and I've been in communication with the lab. I've asked them to send me their validation information about their testing techniques for anything they do. The only test that they have validated is their Lyme test. Their testing for other infections and mold, etc., has not been validated. Okay, now I want to let you know that's important. Okay, so standard labs that so a lot of labs are approved by the FDA, for instance. Okay, labs that have to be approved by the Food and Drug Administration are ones that sell their test kit to a commercial lab to be used. So, for instance, there are test kits that are sold to LabCorp to measure Lyme, for instance. Okay. So if LabCorp buys a test kit, it has to be approved by the FDA. And when the FDA approves it, it means that they've looked at it from a quality standpoint. Independent labs like Vibrant can come up with test techniques, and they don't have anyone overseeing them to make sure their test techniques work. All right. So if they don't have anyone overseeing them, the next thing they're supposed to do is come up with validation studies and be able to show it to doctors like me. And guess what? They haven't done it. So I don't know if anything that your doctor is telling you based on Vibrant testing is accurate. I'll just say that to begin with, okay? If it is accurate in a situation like this, I would probably go after the Lyme. I don't agree that cyclospora, it's a parasite, may be an issue. But viruses, as I just said, I don't go after those first. I think the bigger the bigger hanging fruit on that tree is the Lyme, actually. Okay? All right. All right. Thanks, Charles. Good luck to you. All right. All right, everyone. That's it for me for tonight. I know there's a number of more questions here, but I'm not going to be able to get to them here. So I've enjoyed being with you tonight. And I look forward to visiting with you again in a few weeks now. So again, we'll be off next Thursday and the Thursday after that. Take a look at your email tomorrow morning. I will be sending out an email when I have this video edited, and I also have created a summary of what we talked about in it. Okay. That email will also have information in it about how to sign up for the next series of webinars that will be in October. And I look forward to meeting with you then. That in October, just want to let you know, we'll do 1 week of a webinar. And then after that, the next week, I will actually be in the iLabs meeting down in Florida. And so we're going to do one, take a break again, and then do 2 more towards the end of October. So just to make you aware of that, okay? So yes, I am going to the iLabs meeting, and hopefully I get some new information to help you all. And I'll be glad to share that with you on my return. But keep an eye out. So the first week in October, we will do a webinar. I will be off after that for a week at iLabs, and then I'll be back to do 2 more webinars in October. And you'll be able to sign up for those tomorrow. Okay, so I'll get that information out to you. All right. So with that, I'm going to be heading out. I got to get these 2 Basenjis walked here, my 2 dogs, and